to the Health Show. I'm Dr. Anita Raja, and I'm absolutely delighted to be hosting yet another show. If you're watching us on Facebook, via Twitter, or on Sky 752, it's very easy to be part of our conversation today. Our number is 01924231083, which is on your screens. You've got our WhatsApp number, which is 07950797017. And also our topic of discussion today is very, very interesting. It's about COVID-19 vaccination. Something that we're quite worried about. We've seen a lot of vaccine hesitancy in the BAME community. And of course, that is something that we're quite worried about. So if you've got any questions, line them up and buzz us. Today, we've got Azeem Ahmad with us, Head of Pharmacy at the London Clinic. And he's going to answer most of our questions today regarding the vaccine. And of course, we're seeing that there's a lot that is being done in the community with regards to the vaccine hesitant. We're seeing that pop-up clinics are being put up in mosques, and a lot of work is being done. Welcome, Azeem Ahmad. Welcome to our show.
Thank you for having me.
Azeem, the first question I would like to ask you, we're spoiled for choice now. We've got the Moderna, we've got the Pfizer, we've got the AstraZeneca. Tell us about all these vaccines.
So when it comes to vaccines, I think we shouldn't get too hung up on which one, Moderna, Johnson, Pfizer. And I think what we should look at is trying to understand how do vaccines work and the concept of immunity. What is immunity? And we've been having, what is immunity? You can get immunity, which is passive or active immunity. Passive, you get, the mother passes on to the child. But once you're an adult, you get immunity either through disease, when you actually get the disease and it's full raging and your body will produce an immune response, or you can be vaccinated and be protected from the disease because you've got some protection from that vaccine. And that's immunity, and the vaccines have been around for over hundreds of years. We've been vaccinating people. In fact, the Chinese were vaccinating people over 1,000 years ago. And Africans who'd been enslaved and had been taken over in the 1700s, the Americans there were recognizing that some of these Africans were coming over vaccinated. So this is not a new thing. We've been doing it for centuries. And the key thing here is that we actually get vaccinated. Whatever vaccine you're given, you should actually try and go for it. I will break down and give you a bit more understanding around the newer vaccines and what the differences are between them. But historically, the traditional vaccines that we've had were, when it came to cowpox and smallpox, they were using these live viruses, heating them up to weaken them and injecting them so you'd get an immune response from those vaccines. And then as things moved on, we started to get other types of vaccines where you have inactivated vaccines or toxoid vaccines. But now the modern vaccines that we have are really, there's a lot of science that has gone into them. And with the Pfizer vaccine, for example, there is messenger RNA, which is the protein, the code for the protein for the spike. So it produces an antigen. So the vaccines are, and as a scientist, I'm super impressed that what we've managed to come up with. But all the COVID vaccines are similar in that they all will inject the genetic code into our bodies, and then our bodies use that genetic code to produce the antigen for our immune system. Our immune system sees that antigen and then responds, and in that response, you get your protection from the vaccine. So that's kind of basically what the vaccines are. How the Pfizer vaccine is different, say, from the AstraZeneca vaccine. The Pfizer vaccine is coated differently or delivered slightly differently than the AstraZeneca vaccine, which uses like an attenuated virus to deliver it, whereas the Pfizer vaccine has got a nanoparticle coating the messenger RNA in there. So that's kind of the differences. That's how you managed to get to where we are with vaccines.
You've explained it very well, Azeem. And if you talk about being vaccinated, I think the good news is that Britain has had immense success when we talk about the rollout program and also vaccinating people. 25 million Brits are vaccinated as we speak, fully vaccinated, and 39 million at least have had one jab. So we're in the right direction. But when it comes to choosing the vaccine, as you've said, you know, there is this question that keeps popping up about which one is more superior.
The one that is superior is the one that you take. Any vaccine, if you're offered the vaccine, my advice is go and take it. And depending on where you are, you will either be offered the Pfizer or the Moderna or the AstraZeneca. The one you take is the superior one, because the one you don't take is not going to be of any use to you at all. And really, we don't at the moment have a choice of which vaccine to take. And so you just need to turn up and see what's offered to you. But all of them work very well. And you know how you respond to the vaccine is very individual, depending on who you are and how your body responds to the vaccine. So I would not say to you, you should go for this one, you should go for that one. I just say, go and get vaccinated.
Words of wisdom, definitely. As you know, Azeem, this is a live show and we take lots of WhatsApp messages, calls throughout the show. We've got a message, a question for you. It's a lady who's asked, my son is 15. Is it worth him getting the vaccine? I heard the risk of him getting a blood clot from getting the vaccine outweighs his risk of getting COVID.
The risk of the blood clot outweighs the risk of blood clots. So there's been a lot of conversations around blood clots and the vaccine. I think this is all a numbers game. You know, you've talked about 25 million people have been vaccinated, and with the vaccines rollout, we've saved over 10,000 lives just because we started vaccinating people. And if you put the risk of blood clots into perspective, how likely are you to get a blood clot from the vaccine? Well, you're more likely to get a blood clot, if you're a woman taking the contraceptive pill, if that's what you're doing. You're more likely to die from crossing the road. So do you think twice about crossing the road? And you're actually more likely to be struck by lightning than you are to get a blood clot from the vaccine. And on top of that, if you get COVID, there's more risk of you getting a blood clot from COVID than you from getting a blood clot from the vaccine. So it doesn't make sense to me that you would even consider not having the vaccine if you are willing to take all these other risks. If you're willing to have COVID, to not get the vaccine, the blood clot from the vaccine, that doesn't add up for me. So I'm not worried about the blood clot risk. It seems to be amplified more. And this is really a question where people need to inform themselves the true risks to blood clots and to compare them to the risks that we take every day, like crossing the road or taking other medicines or standing in a monsoon and cooling ourselves while the thunder and lightning is going on.
Yeah, you've put it so aptly into perspective. But there's one more thing that I wanted to add here, you. So if you are pregnant, your risk of developing a blood clot is 1 in 1,000. So literally every 1,000 women who get pregnant, one of them will have a blood clot. So if it comes to the vaccine, it's really something that we need to think about. There is one more question, Azeem, that I wanted to ask you, a question that we get asked a lot. Can you get COVID from the vaccine?
Absolutely not. So how the vaccine works is that we put a small bit of the genetic code into the vaccine, and your body then produces this genetic code, But what it's doing is only producing that small amount, and the genetic code it's manufacturing is the spike protein. So the only thing the vaccine is doing is producing a small amount of this spike protein. So there's nothing in the vaccine. There's not any information to generate the entire vaccine. So there's no way you're going to get it. Sometimes people actually, in between getting the vaccine and it having an effect, actually contract COVID, and that is probably what's happening. People don't get the vaccine, then get COVID from that. It's impossible for that to happen.
Okay, and can you catch COVID after you've had both doses of the vaccine?
You can get COVID. So the vaccines, they will give you between 70 to 95% protection from COVID. What does that mean? What that means is that if you've been exposed to, so 70% is 7 in 10. So if in 10, you've had 10 exposures to COVID, then there's a chance 3 times you will actually get COVID. Now, once you get COVID, if you've been vaccinated and you get COVID, the vaccine does something else. It will stop you from being hospitalized or dying from COVID. So that gives you, even though it hasn't stopped you from getting COVID, your body's had a couple of, already had a heads up to say, you're good, this is the spike protein, I've already spotted it, and it starts the immune response much faster than it would have done. So the virus doesn't have a chance to replicate as fast as it would have done otherwise. So yes, you still can get COVID if you've been vaccinated, but again, it's a numbers game. How much are you being exposed to it? So you still need to protect yourself, still need to wear masks when you're going out to these places where you're at risk. But there's not 100% effectiveness in stopping you from getting COVID.
Okay, so this is a very important answer, a question that we ask all the time about getting COVID from the vaccine. Also, if we are COVID proof after the vaccines, but definitely not. So we've got to look after ourselves and we've got to take care of ourselves. You've got a number on your screens, viewers. Dial this number if you want to ask us any questions. Time for a break in a minute. Stay with us. Stay tuned. Welcome back to the Health Show. I'm Dr. Anita Raja. We were having this amazing conversation around COVID-19 vaccination, and we've got a lovely guest here with us, Azeem Ahmad, who's the head of pharmacy at the London Clinic. We are trying to bust all myths around COVID-19 vaccination, COVID-19, so that we can encourage everyone to come forward and attend their appointment whenever they are invited. If you want to ask us any questions, you've got our numbers on your screen, 01924231083, and also you can WhatsApp us. Azeem, we were having this lovely conversation before we went on to the break about not being able to catch COVID from the vaccine. Also, that if we've been vaccinated fully, it doesn't necessarily mean that we're not going to catch COVID, because we could still catch COVID. Now, there are certain side effects that we're quite worried about with the vaccine. What are the major side effects that you could get if you're vaccinated?
So when it comes to side effects, there's 2 ways of looking at them. We look at them as mild side effects, moderate side effects, and also how common they are. So a lot of people, the majority of people will not get any side effects. But if you do get side effects, most people will get mild to moderate side effects. It's not often you will get a severe side effect. But the side effects that you're probably going to have, the first side effect is when you get jabbed in the arm. There'll be a local site reaction. Your arm might be a wee bit sore for a couple of days. That's just because someone's physically put a needle into your arm. Your body has to recover from that. Once the vaccine has been administered and your body starts to produce the spike protein, then your immune system starts to recognize this as foreign and it starts to produce a response. And when your body is producing that response, that's when you get the side effects. So you may get a slight fever, and those side effects are similar to as if you were having the actual infection. So it's the same immune response that's producing a side effect that you would have if you actually had the vaccine. So you might get some fever, you might get muscles aches, maybe some chills or joint pain. So these are the typical things, and these are typical for when your immune system is ramping up and producing an immune response. So that's what those side effects is all about.
Okay. Azeem, I wanted to particularly ask you in terms of the AstraZeneca vaccine. There was a lot of debate around having headaches which last more than 4 days. So what would you advise to people who've had the jab and have got a headache which lasts more than 4 days?
So take paracetamol for the headaches, and obviously, hydrate, drink lots of water, take paracetamol. And if your headaches are continuing and you're worried about them, then you should seek medical advice if you are worried about these headaches.
Okay. And all our viewers who are watching this show, if they want to get jabbed, where can they go? How can they access the vaccination centres?
So at the moment in the UK, the vaccine is only available via the NHS. And right now, anybody who's over 30 before the 1st of July is eligible for a vaccine. So you just need to contact, if you haven't already received a message from your GP surgery, you can contact them and ask them, and they will advise you where your local centre is to be vaccinated. But also we're having some pop-up centres coming up now, so listen into what's happening in your community. In Twickenham, there was a mass centre for anybody to go and be vaccinated. So if you are quite keen, keep an eye out on what's happening locally for you. But if you're eligible, you should already have received a message, and you just simply need to follow up from that message and go along to wherever it is that they send you. They might send you to the GP surgery, they might send you to your local hospital, they might send you to some like the Francis Crick Institute, or all sorts of places that are opening up they're opening up these vaccination centres. Wherever it is, just go and get vaccinated.
Lovely. Azeem, we've seen a lot of hesitancy in the BAME community. The uptake was 30% rest compared to our Caucasian counterparts. And a lot of work is being done at the moment. We can see that there are pop-up vaccination centers and mosques. And of course, people like you are coming and talking about it so that we can bust all types of myths. However, there is this high risk that the people from the BAME community are at in terms of catching COVID. Why is that?
Yeah, this is a conversation which has been debated as to why. Definitely, in the BAME community, we are more at risk of catching COVID, and then once we catch COVID, then the risk of dying does increase for people in the BAME community. Why is that? There's multifactorial reasons. Within the BAME community, there's a lot more multi-generational living, and so you will have grandparents living maybe next door or close by to parents and grandchildren, and there's a lot of visiting as well, and with larger families visit each other, so there's a lot more interactions. And again, remember I said this is a numbers game. How many opportunities do you have to be exposed to the virus? So when you've got more people visiting more people, it's like multiplying by multiplying and multiplying the risks around that. And also within the BAME community, there's a lot more comorbidities, increase in diabetes, which will increase your risk once you have COVID, and also heart disease also, decreases your chances. Once you get COVID, you will become sicker if that is the case. Also, unfortunately, within the BAME communities, there's some more deprivation than our Caucasian counterparts, and just the fact that people are living in deprivation, adds to a whole bunch of risks themselves. But it's some of the jobs that people are working in the BAME communities have a higher face-to-face interactions. So again, that's a numbers game. So like a lot of doctors, opticians, dentists, taxi drivers, all of these, there's more of the BAME community represented in these jobs. So therefore, there's again more exposure happening within the BAME community, and then they go back into their households, to their multi-generational households, and then they visit each other, and so it kind of expands. So therefore, the risk is higher, more exposure, they're sicker, and so that's why the people are dying more as well. So it's really important that within the BAME community, we actually try and stop the spread and decrease the numbers. And actually, if we get vaccinated, that's a major block in stopping the vaccine spreading within the BAME community.
And there was a lot of concern in terms of the NHS health workers as well, who were from the BAME community, because their uptake was quite low as well. What sort of message do you have for healthcare professionals who are frontliners, putting their lives at risk, but not coming ahead when it comes to getting vaccinated?
This is so important. We had a conversation within our hospital around healthcare professionals getting vaccinated, and there was, I had an open Zoom session, and people were able to contact me from our hospital, and some of the questions people were putting towards me was that my family don't want me to get vaccinated. My family are worried about this. But healthcare professionals are key. We are the ones who have the information. And it was great because people came to me and they asked me the question, how safe are these vaccines? What are the side effects? Will it make me infertile? Is Bill Gates going to put a chip into my arm? There was all sorts of really, really silly questions, which people were actually worried about. And really, for healthcare professionals, we have to educate ourselves so we can then go out and educate our communities and our families and encourage them to be vaccinated. It's so important that healthcare professionals are role modelling this and demonstrating actually that these vaccines are safe, so that our community will look at us and say, well, they've been vaccinated, so I'm going to be vaccinated. Obviously, it's safe, because otherwise they wouldn't do that if it wasn't safe.
Azeem, you've touched on it rightly. I mean, there's a lot of concern, even in general practice. Women who are of childbearing age ask lots of questions around the vaccine and its effect on future fertility. What do you have to say to that?
There has not been any evidence to suggest that there's any impact on fertility. There's just no evidence for that. And when we look at the clinical trials around the vaccine, normally when we do a clinical trial on a new medicine, they will select a large cohort of patients, and they normally pick around about 2,000 patients, and they'll try these medicines in these 2,000 patients and look at the side effects and look at all sorts of things, different parameters that they measure for side effects, and they look out for them. For the COVID vaccines, for the Pfizer vaccine, it was trialled in 44,000 people. That's a huge group of people to be clinically trialling a medicine on, and they did not come up with any evidence of infertility there. So we would ask, what is the concern? Has somebody said to them that they're going to make them infertile? Where did they get the evidence from? Because from the clinical trial data, there is no evidence for that.
Okay, and just really quickly, what about vaccinations in pregnancy, or if you are undergoing IVF?
That's an interesting one. So there you have to do risk assess when it comes to pregnancy. And initially there were some concerns around, we don't know, we don't have that data. But now more and more data is coming through around pregnancy and the risks associated with that. And it generally seems to be okay and fairly safe to be vaccinated. What we would suggest is, if you are concerned, speak to your GP, or if you're going through IVF, speak to the doctor at the IVF clinic around what they are suggesting and the impact and how you can minimise that. There is no real interaction with medicines that we know of with the vaccine itself. So I'm not concerned around interactions as such. It's more around how are you going to respond? If you've got a fever, how's that going to impact on the IVF treatment that you're going through? If that fever is going to change, or decrease the chances of something settling. So this is very complex. That's something which you really need to have a conversation with the person who's monitoring and seeing and really understands all the impacts there. So I would not rule it out, but I would say have the conversation with your healthcare professional who's looking after you, your doctor who's looking after you. Have that conversation.
Azeem, thank you very much for answering all these questions. I think it was an amazing show because we happened to ask all these questions around COVID-19 vaccination, questions that we've been asked on a daily basis from our patients as well in general practice. And of course, there are lots of information on the internet. The internet is a free space, and of course, people use it. But it is very important that you ask your GP or a healthcare professional if you've got any questions around it. Thank you so much for being part of our show. And we're hoping that you're going to join us again next week. Thank you for watching us.